The urinary bladder is a storage hollow organ where urine is stored prior to micturition. It is located in the pelvis, posterior to the pubic symphysis and superior to the perineum. The examination of the urinary bladder is important in the evaluation of patients with urinary complaints such as frequency, urgency, incontinence, and dysuria. A urinary bladder examination is performed to assess the size, shape, and consistency of the bladder. The examiner may also palpate for bladder tumors and any areas of tenderness. Auscultation of the bladder is performed to detect any abnormal sounds, such as a vesicular murmur. The urinary bladder examination is generally safe and well tolerated. However, there are some risks associated with the procedure, such as abdominal pain, urinary tract infection, and urinary retention. Urinary bladder problems can result from a number of conditions, such as infection, stones, tumors, or injury. Some of these conditions can be quite serious, while others may be easily treated. The most common symptom of a urinary bladder problem is pain. Other symptoms may include urinary frequency, urgency, or incontinence. If you are experiencing any of these symptoms, it is important to see a doctor so that the cause can be properly diagnosed and treated. Urinary bladder problems can be divided into two broad categories: problems with the structure of the bladder, anatomical problems, and problems with the function of the bladder, physiological problems. Anatomical problems can be further divided into congenital abnormalities and acquired abnormalities. Physiological problems can be further divided into disorders of urine storage and disorders of urine elimination. A urinary bladder examination is a medical procedure in which a doctor or other healthcare professional inserts a gloved, lubricated finger into the patient's rectum to feel for any abnormalities in the urinary bladder. The exam is usually quick and relatively painless.